Hello, everyone. Welcome to Glific vodcast. This is a monthly podcast that we have where we talk about our platform. We also have our NGO partners who come here and showcase the work that they have been doing onto Glific. Before we begin, I'll just quickly give an intro about myself. I am Sneha, and I work here on Glific as a business development and sales lead. My work here revolves around talking to NGOs like you, understanding how can Glific be part of their journey, and how can they reach to more number of people. Here with me, we have Mohammed Shamoon. He's working as a software developer here with us. And we also have Arogya World's team here. From Arogya World, we have Varun. I'll ask Varun to quickly give a brief introduction.
Thank you, Sneha and Shamoon. Good afternoon, everyone. I'm Varun, Program Manager for mHealth at Arogya World. And along with me, Meeta Valavalkar has also joined, who's our Chief Program Officer. And the program I'm going to talk about is basically something that Meeta and me had worked on last year, along with Shamoon and the rest of the Glific team. So I'm really excited to talk to you guys about the work we've done. And yeah, Sneha, is there anything else you have to add?
Yeah,
Okay, great.
This is good. Thank you so much, Varun, for that introduction. Okay, so I am going to just start by sharing my screen. And before I do that, I would also request you to share from which organization are you part of, and where are you based out of in the chat window. Okay. All right. Thank you so much, Muskan. Welcome, Muskan. Welcome, Ayman. We would request you to also just we would request other people to also keep sharing, keep using the chat window to put questions, thoughts. Would be great if you can mention where are you joining in from, and feel free to use the chat window during this time. Okay. All right. Can you see my screen? Is my screen visible, Shamoon?
Yes.
Yes.
Okay.
It's visible.
Okay. All right. So let's just start. Okay. So what we're going to talk about today is so today we're going to talk about a couple of things. We're going to talk about what Glific is, what is a chatbot. So here there are a couple of different type of audience we have today. Some who have already been part of Glific and some who are joining for the first time. So please bear with us when we talk about the introduction to Glific. This might seem like a repetitive thing for you, but this can be a useful thing for someone who's joining for the first time. Okay, so we're going to talk about Glific. Then we'll move into talking about Arogya World's case study. Then we'll move into talking about platform features, and towards then we'll talk about how can you start your journey on Glific. Okay, all right. So let's just quickly talk about what are some of the aspirations of non-profit organizations. We have spoken to so many organizations, so many NGOs in the past, and we have realized that most of these NGOs say that they want to scale and they want to increase the reach of their end beneficiaries. That's one important aspiration. The other one is how can they reach to that audience with the use of technology, how can they reduce human errors? How can they reduce dependence on human intervention? I'm not talking about replacing them, but just reducing the amount of load that's there on the human system. And how can they use technology, and also while keeping the operational efficiency high, how can they use the technology while also keeping the costs down? So these are some of the aspirations that we have seen in the past, how NGOs have what NGOs plan to do when it comes to impacting more number of people. And that is exactly what Glific supports NGOs with. So Glific is an open source digital communication platform. We help social impact organization to bridge the last mile gap digitally via smartphone. It's a WhatsApp chatbot platform. We are working with more than 70 NGOs right now, and in 5 different sectors. And through these NGO partners, we are reaching to more than 334K end beneficiaries. These are some of our NGO partners. See if you can recognize any of these organizations here. Okay, so talking about those 5 sectors, we are working with NGOs in agriculture, civic engagement, education, healthcare, legal, and finance, and we are spread across 8 different states through our NGOs. Okay, now let's just pause and talk about what is a chatbot. Most of you would definitely know what is a chatbot, but some of you might not know. So we'll just spend 2 minutes to talk about what is a chatbot. So when we talk about WhatsApp, the first thing that we use on a day-to-day basis is the personal WhatsApp that we use to communicate with our friends and family on a daily basis, on a regular basis, right? It's an app-based platform. And then we have WhatsApp Business, which is like a one-to-many solution, but it's an app-based thing. And through that, you're able to reach to a limited number of audience only, because that one person is only exchanging the messages over WhatsApp. So there's a limitation when it comes to scaling your impact. Then in order to scale your impact, we have WhatsApp chatbot, which is basically a platform based solution which helps NGOs to scale their impact through a platform based solution. Okay. Okay, let's talk about what is a WhatsApp chatbot. So basically, WhatsApp chatbot is a one-on-one interaction tool, communication tool, through which you can automate the conversations that you're having with your users on a daily basis, and reduce the human load. And reduce the human load. Okay, let's just talk a bit more how you can use chatbots. So chatbots can be used in a multiple different ways. I'm just going to talk about different sectors and all of those things in a while. But how does chatbot helps you? It helps you in overcoming some of the barriers, which is adopting a new technology. Through WhatsApp chatbot, you can have conversation in multiple languages. It also overcomes the barrier of low literacy, low connectivity, and low-end devices. And it also overcomes the barrier of one-way communication. So one-way communication is just you communicating with them all the time, versus through chatbot, you can have a two-way communication where the other end beneficiary is also able to talk to you. Okay, how NGOs are using Glific. So some of the sectors which I'm just going to talk about few sectors here. One is education. So our education-based NGOs are using Glific to send worksheets, track class performance, deliver teacher training, and track progress. Healthcare NGOs are using it to send weekly reminders on health statuses. They can also set up counseling or helplines. They can also automate some conversations and put an FAQ in place so that people can, refer to those whenever they need it. Some of our agriculture-based NGOs are using it to send farming advisories on time, sending weather updates on time to their farmers, sharing live mandi rates for their crops. So wherever you see that there is a scope to interact with your audience, interact with your beneficiaries at scale, Glific can be a right fit for you. Okay. So now we're gonna just talk about Arogya World's use case. I invite Varun here to talk about how they used Glific for their mDiabetes program.
Thank you, Sneha. Thank you for giving us this opportunity and also helping me put this presentation together in a presentable form. Thank you for that. So, Sneha, can you share screen?
Just a second. Yeah. Okay. Yeah, Varun, you can
Okay.
go.
Okay, great. So, as I introduce myself, Meeta Nidhi. So Nidhi has also joined from our organization. Nidhi is the director of M&E at Arogya World. So Nidhi, Meeta, and me work for Arogya World. And as you can see, our prime focus is prevention of non-communicable diseases. So Sneha, can you go to the next slide? So I'll set context here. And most of you would already know how rampant non-communicable diseases are in our country, in Southeast Asia, and in the world as a whole. But some quick facts for you to understand how deep the problem is. So, in 85% of deaths in developing countries, premature deaths in developing countries are due to non-communicable diseases. 30s is the age at which we see an onset of non-communicable diseases. 66% in our country die from NCDs. 75% of the people in metro cities are diabetic and pre-diabetic. Currently, India has 77 million diabetic people. And this number is set to increase. And soon we'll be the number one, the country with the most number of diabetics by 2045, where we will be having 134 million diabetics. So the problem is at scale and it is alarming. And that is exactly what we're trying to tackle here with our NCD prevention programs. Next slide, Sneha. So we might have heard the saying, prevention is better than cure. From childhood, our parents, our teachers drilling it into us. And that's exactly the simple solution that WHO suggests, which is that by following a healthy diet, by including exercise in your daily routine, by avoiding unhealthy habits like consumption of tobacco, alcohol, avoiding fried fatty foods, we can prevent 80% premature heart diseases, 80% type 2 diabetes, and 40% cancers. So this is the premise on which we have set up this mDiabetes program, which I will be talking to you about. Sneha, next slide. So just some small facts about the reach that Arogya World has and the places that we have worked in, the communities we've worked in. So our focus area is non-communicable diseases. We've worked in around 19 states and union territories. We've reached out to 9.3 million people as of now. And going forward, we target reaching out to 50 million people. Below, you can see some of the recognition that we've received over the years. The most recent being we've been recognized by the UN Interagency for interagency task force for prevention of NCDs. So that is another feather in the cap, which was added in 2022. Next slide, Sneha. So this is our doorstep health model where we try to reach out to people um, in uh, in the places where they live, in the places where they learn, and the places where they work. So the program that I'm working on along with Meeta is mDiabetes, which I'll be speaking to you about more. Along with that, there's My Thali, which is a program based on eating right, where we talk about the right portions and what really should go into your daily meal. And this is where we focus on uh, rural women and adolescent girls. Next, we have Healthy Schools program where we work with children on the same idea of preventing diabetes and bringing about behavior change. Sneha, can you go to the previous one? Yeah. And lastly, the Healthy Workplace is where we work with companies to audit and advise them on their health and wellness programs for employees. So next, yeah. So now moving on to mDiabetes, which is the topic of discussion. mDiabetes basically is a mobile-based diabetes prevention program. And initially we were sending out these diabetes prevention messages for 6 months via IVRS and SMS only. It's last year when we embarked upon this new journey where we explored WhatsApp and how we can leverage WhatsApp to bring about behavior change. Our content is available in 12 languages. We've worked with renowned institutions on healthcare. As you can see, Arvind High Hospitals, LV Prasad High Institutes, Johnson Johnson, Nokia Care, RIST. And till now, we've reached out to 1.5 million people. Next slide. And our program has shown 15% behavior change. And there's a paper on this as well, which you can access on our website as well. So now moving on to the program which we had worked with Glific on. So in 2021, Arogya World was awarded Google's AI for Social Good workshop. And we were in a constant pursuit to understand how we can leverage AI on WhatsApp to bring about behavior change. So this was a study. Initially, we had thought of looking at 1,600 people, and that is the number of people we got during baseline. So I'll get into that. Initially, just a small introduction about the key stakeholders in the program. So we were working with University of Oregon's computer science department to develop this dynamic and personalized text messaging intervention based on weekly feedback of users. And our implementation partner was Head Held High, which is NGO based out in Bangalore. And the location where we implemented our program was in Gulbarga, Karnataka. And a total of 1,049 users opted in successfully to the chatbot. And our control group, which is the non-AI group, had 501 participants, and our experiment group, which is the AI group, comprised of 548 people. So the AI group, the experiment group got 2 messages and 2 questions each week on a Friday and Tuesday, and non-AI group, which is the control group, got 2 messages each week on Thursday and Monday. So going back to the point that I mentioned at the start, so during initial recruitment, we had around 1,698 users, but then it dropped out due to users not really being familiar with this opt-in process. So that's one learning which I will get into once I like run you through the more basic aspects of the program, but just something to remember. So what we saw on a very like basic level was that the response rate of people in the AI group, as you know, the people in the AI group were getting 2 messages and 2 questions each week. So the response rate, what we saw in the AI group was quite low when we started, but then gradually it picked up and we saw around 50% response to our weekly questions, which probe into their healthy behaviors. And we had a dashboard that was set up by Glific where we were tracking the read receipts and the response rates of users. And we found that 71 to 75% of respondents were reading the messages on a weekly basis. Next slide, Sneha. So this here is the logic that was basically used to set up this AI chatbot. Definitely, there's a lot of technicalities involved in it, which we can address towards the end of this session, or maybe you can write to us as well. So it's based on reinforcement learning system. And so basically, each participant had to answer a baseline survey where we were trying to understand their knowledge about diabetes, the causes and complications, how much physical activity they were including, their eating habits, all of this. And based on that information, we created a health profile of each user. So below what we've written is something that I'll read out, and that'll explain to you how we basically went about deciding what sort of messages should be sent to users the following week. So each participant state consists of scores for the 5 category: healthy food intake, unhealthy food, tobacco, alcohol intake, fitness, physical activity level, diabetes cause knowledge, and diabetes complication knowledge. Each score value falls into 1, 2, 3, in which 1 means low, 2 means medium, and 3 represents high. For example, if the score for the health food intake of a participant is 1, it means this participant rarely consumes healthy foods such as vegetables and fruits. Thus, this score implies that this participant should receive messages that encourages this participant to eat more healthy foods. So through this risk score that we assign at the start, the machine gradually tries to understand what is that person's predisposition to a certain risky behavior or unhealthy behavior, and depending on that, messages which try to bring about change in that unhealthy habit were targeted to that person more frequently. So that is what is exactly happening in this flow diagram that you can see. So the people in the non-AI group, which is the control group, just received the regular 57 messages over a period of 6 months. But for the experiment group, which is the AI group, people were receiving weekly messages along with that, they were getting questions also. And based on the responses of the users in that particular week, we could decide what sort of messages we had to send out in the subsequent weeks. So that is the logic behind the AI model that we had set up. And if there are any detailed questions, you can throw it, shoot it across towards the end. Sneha, next slide. So here we see the chatbot as is, as the user would have seen. The only difference here is that we had everything in Kannada, and here you see it in English. Only the last one you have some bit of Kannada. So starting with the flow, the user sends a hi, then we ask for a language preference. Then again, we ask the user to confirm their enrollment in the program. Then moving on to the second image, they give their preference for time. Then after that, they are opted in successfully into the program, following which they start getting messages. And then as you can see in the third image, you can see that this is basically the message that the person in the AI group receives. There is a message that they receive, and then there is a subsequent question that goes along with it. So there is, if I look at the message that has been sent in the third image, hi Mohammed Shamoon, in India, diabetes is a huge problem. At least 7.7 crore people in India live with diabetes. Diabetes kills 10 lakh Indians each year. And then there's a question that follows. So each week, they receive 2 messages and 2 questions, and depending on the responses to these questions, the AI model predicts what sort of message needs to go out the following week to ensure that the person is bringing about the necessary changes to lead a healthy lifestyle. Next, Sneha. And here we just have a screenshot of the dashboard that we had in place to understand the engagement of users with the chatbot, but I'll just go over the most important ones. So the first dashboard is basically giving you an idea about how many messages were delivered, how many had blue ticks, which means that they had read, uh, how many had just received, how many messages were sent, but they weren't received on the phone, which is a single tick. So things like that were monitored. Moving on to the next one, um, which is more specific to our program, because we were tracking how many users were responding to each of the weekly questions. We had a tab for user answered. So for each week, we could track how many people answered to each question. And on the basis of that, we could take steps to inform the frontline workers on the ground to maybe do another round of sensitization where they go around telling people, checking if they have any problems with the WhatsApp bot, and helping them out. So the dashboard really helped us in. Um, so to be very honest, there is definitely human intervention required apart from setting up the chatbot, where we have to reach out to people at different stages of the program and tell them, okay, remind them that, okay, there are these messages that you're receiving and you have to respond to these questions. And to be fair, it was a one of a kind intervention for the people in those communities as well. So we kept our patience, and then we looked at the data, and on the basis of that took decisions, which helped us keep, sustain these engagement levels. Next, Sneha. So now moving on to the study findings, and the entire report on this study can be found on our website. So I'll put the link to uh, our website in the chat after the presentation is done. But in terms of knowledge comparison, we see that 58.3% of the participants have positive score changes in the category of diabetes cause knowledge, while 19.4% have a negative score changes in that category. So we definitely see a positive change in the knowledge levels of people in the AI group. Uh, and definitely we cannot really expect that these changes would be like a 20% change or like a significant change. This is the first time people are getting used to getting the hang of something like this, and getting this sort of result is in itself like a very big achievement for us. Next slide, Sneha. In terms of physical activity comparison, we saw an increase in incidental exercise, that is people moving on to doing more household chores, taking stairs instead of elevators, engaging in physical activity more, where we saw AI group showing an improvement of 47.9% and non-AI group showing an improvement of 36.1%. Next slide. Now, moving on to the last metric that we were trying to understand, which is dietary comparison. Here we see improvement in non-healthy food consumption category. So AI group shows substantially more improvement compared to non-AI group. And here also we were trying to, in the non-AI group, we were only considering people in the assessment who had responded to 50% or more of those weekly questions. Only then we thought that we could really figure out if the AI was working or not. That is just about the findings of this of our study. Now, moving on to where this really takes us in this year and the coming years. So Glific has really helped us in a lot of ways in understanding this whole chatbot business from scratch. People like Shamoon, Abhishek have really handheld us and took us through all of these processes which have to be in place to set up a fully functional bot. So going ahead, we are definitely looking at WhatsApp as that medium of engagement more than SMS and IVR, because right now WhatsApp engagement otherwise among people in India is high. People seem to be engaging with WhatsApp more than what they used to before, not just in urban communities, but in rural communities as well. So going forward, first of all, if we have to draw from the learnings of the AI study, we will definitely want to implement it with a larger cohort of people, maybe 1 lakh plus, and train the AI tool better to understand understand the sort of responses people give to this personalized messaging system. And apart from that, one thing which we like, it was more reinforced. I mean, we were part of the WhatsApp incubator program.
Hey, Varun, are you there? I think Varun lost his internet connection. We'll just yeah. Can you hear me, Nidhi?
Yes, you're audible, Sneha. I think Varun's internet is.
Yeah. Yeah. Okay. Okay. Varun is back. Yeah.
Yeah. Hi, Sneha. Sorry, my there's a power cut over here and my Wi-Fi just went off.
No
Really
problem.
sorry for that. So, as I was saying, right now the next move would be to redesign redesign the chatbot look and feel. Firstly, wherein we look at rich content related to the messages that we put out, which means to say that we'll be looking at adding more videos, images, PDFs. Then modifying the flow itself is something that we are looking at, where we want to probably get an idea of what sort of, apart from the baseline survey, we probably want to do a health risk assessment, understand the real needs of the user, and then target the content that is specific to that risk profile of the user, be it diabetes prevention, be it diabetes management, heart health, smoking cessation, stress reduction. And then, as Sneha had pointed out earlier, a lot of health NGOs also have a section or a feature in their chatbot where they can talk one-on-one to a doctor or someone who can counsel them about their health conditions. So putting something in place of that kind is something we're looking at. And also, like I was saying, refining the AI model to understand how better this tool can be made and how better it can predict a person's, like, what sort of messages should be sent out to people who are onboarding on the program is something that we want to understand. So these are some of the features that Glyphic, like, it was already there, and these are some of the things that we would want to adopt in our chatbot, like rich media attachment, like multiple languages is definitely there, but allowing users to choose multiple languages. If we have content in 12 languages, then allowing them to do that. Messages would interact with the users with such that they provide feedback to them, are all things that we really want to work on. There's a lot of things I've put down here, and it is food for thought for, I think, many years, and that's what we're doing right now, working on everything bit by bit. And this is version 2.0 for Arogya World's mDiabetes. And I mean, Meeta, would you want to add anything to it if I missed out on anything?
No, I think we are good, Varun. I would just say that we've had a great run in terms of mDiabetes, going from an SMS based platform to IVRS, now on WhatsApp, which was initially a static model. Then we built in AI. We made it interactive, and now we are looking at a new avatar of this program in itself, in terms of creating multiple profiles, more interactive, more predictive models, and I wouldn't say prescriptive, but more from point of view that relevant content is given to people, and not because the world is moving towards that, where hyper customization is what is needed. So, and that's where why should we, from an NGO point of view, stay back, right? I mean, to catch up with the world the way it is moving. Hyper customization is what we are looking at in terms of giving relevant health education content to people depending on their needs. That's where our focus is right now, and around that the features will be built. So yeah, thank you.
Thank you so much, Meeta and Varun, for this. Okay, so I'll just open the floor for one or two questions. We are running short on time, but we'll take one or two questions that audience want to ask Varun and Meeta. So you can just unmute yourself and ask the question.
So either we were very clear or we were not clear at all.
Okay. Okay, no questions. Then I'll carry on with the presentation, and we'll open this floor again towards the end so that you can ask questions to the Glific team and also to Varun and Meeta. Okay. Okay, just a second. Let me just quickly share my screen again. Okay, so let's just quickly talk about some of our platform features. And talking about the platform feature, I request Shamoon to quickly share his screen. We'll just give you a demo of the platform, how the platform looks like, and how Arogya World built their their conversation on our platform. Shamoon, can you please share the screen?
Yes, Sneha, I don't have share screen access. Okay, got it now.
I've given it to you.
Yeah, sure.
Okay.
Let me know when my screen is.
Yeah, it is visible. Thank you, Shamoon. Okay, so this is how the dashboard of Glific looks like. This is the platform. And on your right side, you would see all the chat communication that has happened from your platform. So all the messages that were exchanged with the end beneficiaries were can be accessed from this right side. Now, if you will go to flows, which is on the left side, Shamoon, can you take us to the flows? Okay, this is loading.
Sorry, my internet is kind of slow today.
No problem. Okay. Basically, Flows is a conversational builder which an NGO can use to build communication, build conversation with their for their end beneficiaries. And okay, you're going to log in again. Okay. Okay. We'll try one more time. Okay, so this is how the flow section looks like. It has multiple flows in it. Flows are basically conversations that you have, that you plan to have with your end beneficiaries. This is the structure of the conversations that happened on the mDiabetes program. And here on the platform, you can just, it's a very basic drag and drop platform. We can just drag and drop nodes here to build the conversation that you plan to have with the beneficiaries. There is a preview section at the right side, where whatever conversation you are having on the you're building here can be accessed here, so that you can see what sort of messages you're planning to send to your end beneficiaries. Okay, so now let's just go to template messages. Okay, so template messages are pre-approved messages from WhatsApp. So every message that falls out of the 24-hour window and you plan to send to your end beneficiaries needs an approval from the WhatsApp team. So all your messages which are sent from your platform to end beneficiaries are here. These are basically nudges which you can use to send on a weekly or on a weekly basis. So here, this is how a template message looks like. Sorry, Shamun. Yeah, this is how a template message looks like. So you have to get this message pre-approved, and there's a preview window to see how a message looks like. Okay, Shamun, can you take us to the interactive message? No. Okay, so interactive messages. So at times what happens is, when you are having a communication on WhatsApp, when there is a language barrier, at times what happens is whatever your user is typing to you, they might have some errors in terms of the message that they're planning to send to you. So what option we give is, you can build interactive messages. Interactive messages are messages that have different options that you can customize. Shamun, can you just open one interactive message? So these are like buttons. We use this message to in Arogya World's bot, where we ask the user on the language preference. So this has 3 different types of language option given. Instead of you don't want user to type that particular language, it's better to just give buttons to them. Okay, now on the left side, there's also an option to go to collections. Shamun, can you just take us to collections? Here you have collections. Here you have staff management. So collections is basically if you want to club different users on the response that they have shared with you. So it's basically, you want to send one particular message to a particular group of audience. That is something which you can send from the collections section. And we also have staff management, where you can control the access of the platform. Okay, thank you so much, Shamun, for this.
Sure. Should I stop sharing?
Yeah. Okay. Okay. Okay, so there are a couple of things that you can also do to reach out to your end beneficiaries and unlock amazing possibilities for your users. So we have a lot of advanced features that are available on Glific. One is natural language processing. Other one is voice support. We have Google Sheets integration. We have seen NGOs using Google Sheets extensively. Now through Google Sheets, you can directly access your platform and change the content change the content on the conversational flows. You can also have multi-profile access on the same device. So if there are more than one person in your family who wants to use WhatsApp to, either access educational content or any sort of content, so that can be done through Glific. You can track their individual journey and also send personalized content to a different user segment. Okay. Why Glific? So Glific is basically built for the nonprofit sector. So we have more than 70 NGOs currently with whom we are working closely. It's a no-code platform, so you don't need any technical expertise when it comes to using Glific. It's very easy to launch, easy to pilot and scale. And there's a lot of extensive documentation available on GitHub. So in case you have any you want to know about any feature or any particular advanced feature, so you can just access our documentation and learn how you can use those for your particular use case. We're also a strong community. By that I mean is we offer extensive support through our Discord channel. So Discord channel is a communication platform that we use to communicate with you so that your query gets resolved in less than 24 hours. We offer we also host sprints. Sprints are places where NGOs come together, they work on their use case, they learn from each other, and they also get their chatbot to the next level. We host these sprints on a quarterly basis. And then we have spotlights. Like today we have Arogya World with us. So like this, we have a spotlight session every month where we talk about the use case of a particular NGO. And we also have spotlights on the advanced features or features that you can use to enhance your offering. Okay, I'll just quickly talk about how can you get started. So Glific's our offerings is basically in two modes. One is do it yourself, which is a SaaS offering. In that we will give you the access to the platform. We'll do an onboarding conversation with you, and then you can go ahead and design the conversational flows on the platform. And the other one is the consulting mode, which is more like do it for me. So Arogya World was our consulting NGO where we worked closely with them, and we worked on designing the conversational flows and customizing the platform as per their need. Talking about the setup, Glific setup is very simple. So one thing you need is a phone number in place that you're going to use for your chatbot. The other one is the Facebook Business Manager verification. Post that, we will set up your accounts on our platform, and once that is done, you are ready to design conversational flows. Talking about the pricing, so Glific offers a subscription-based pricing. I'm going to just send a link on the WhatsApp, on this chat window, so that you can go through the pricing, and in case you have any questions, we can take those questions up. Okay, and once you're ready, you just send one-pager brief of your requirements to us. We expect you to allocate at least one team member from your team to manage the platform. And and that is it. You just then design conversation flows and send messages to your people. Okay, so here we are at the end of the presentation. So with the need of designing user-centric tech solutions and the rise of AI, NLP, nonprofits globally are adopting chatbots to deliver their programs. So are you next? That's a question for you. Okay, all right. Thank you very much for listening to us. Now I'll just open the floor for any questions that you have.
Now, Sneha, there are some questions in the chat box. Maybe if you
Yeah. Yeah.
the chat box.
Yeah. Thank you so much, Meeta. Okay. Shamun, do you want to take the first one?
Sure. So NLP is natural language processing. So in a normal conversation builder, what you suppose a person gives an answer yes, no, and based on that you create a conversation forward. So if a person says yes, then move to the next message. If a person says no, move to another message. But sometimes in real conversation, what happens is you don't know what the message could be. It could be yes, it could be or a spelling mistake. So what NLP does is it categorizes your response into something like harm also means yes, yes also means yes is a spelling mistake also means yes, and based on that it moves to the next conversation. So NLP is basically to process the natural language that a person speaks and send messages according to that. Let me know if that clarifies the question. Muskan.
Okay. Thanks, Muskan. So Rukmini, the pricing difference for the two cases is, so the basic pricing is the subscription fee and the one-time setup fee that we charge. I've shared the pricing link with you. So so that is something which is common in both the cases. But on top of that, there is consulting charges. Consulting charges are basically hourly charges that we charge, depending on what sort of customization you want on your platform. And for 0 to 10 hours, it's 3,500 per hour. And depending on what is your use case and how much, how many hours of engagement you want from the Glific side, it varies. So it's there in the pricing calculator. Okay. Any more questions? I have a question for Varun. Varun, so I know you are working on version 2 right now. I know you have already spoken about putting rich media content and other things in place for version 2. Are there any target audience in mind for version 2 that you have? Is there a reach goal that you have in mind, and are these new features linked to that?
Yeah, so if you look at Arogya programs, I mean, specifically mDiabetes in the past, we've always looked at a reach of at least 1 lakh people. Nokia was 1 million people. So we focus on large scale diabetes prevention programs. So the next step would ideally be to test out this tool and refine it with a larger population. That's step one. And then definitely if you, in terms of demography, we don't really have like a specific place we want to implement it, but then definitely we would want to cover both spectrums, the rural, for the rural population as well as the semi-urban population. So these are the goals going ahead. So
Just to add to
nothing
what,
specific in terms of, yes,
sorry,
ma'am.
sorry, Varun. Just to add to what Varun was saying, our next step is also keeping in mind the data penetration in India, the smartphone penetration and data being so cheap, and WhatsApp as a platform has is omnipresent almost in the most remotest of the villages in India, and that's become a primary mode of communication these days. A lot of content gets consumed on WhatsApp, and going by the whole, the TikToks getting so famous, although it's banned in India, but these short videos, consumption of short videos has gone up. So in short, what I'm trying to say is that people have stopped reading long content, whichever platform that we offer it on. So people are looking for more interactive, more engaging content that is fun to consume, but also educational. And that's where our head is, that we understand that we can access rural communities. WhatsApp is not an urban phenomena anymore. It is gotten into rural parts of India, and it's increasing every day. We just want to go with the flow of giving people the kind of content which is basically easy to consume and understand. What are we after as an organization is impact. So we basically want people to understand how to lead a healthy lifestyle and avoid prevent diabetes. So if if through our pre and post research we can show that by doing the new feature changes we've increased the impact, then we've hit a home run. So that's where we are.
Thank you so much, Meeta and Varun, for answering that question. Any questions from the participants here? Okay. What type of data can be collected using Glific from WhatsApp? Can it be customized depending on the program? Example, can you see data on the responses for an interactive messages? Okay, Shen, so the answer is yes. So depending on how your conversation is, how you're planning to build your conversation, you can, design your data dashboard in such a way so that you can, see responses to that particular question. Now, let's suppose I'll just quickly show you one dashboard. So when you get onboarded onto Glific, we also help you set up your data dashboard, which is Google Data Studio, and through that you can actually customize what sort of data you want to monitor and track. So this is a sample or template of data dashboard. Depending on your conversational flow, you can customize this this dashboard. So let's suppose you are asking a question in your conversation saying, do you go to school? Very basic question, yes or no. Here you can, you have two buttons with yes and no as responses, and you want to see how many students are actually going to school. You can have a question here, which is then which will have then two options, yes or no, and then responses can be shown here, how many clicked yes and how many clicked no. So that is something which is possible. Okay, here is the link. You can also have a look at this. Okay, any more questions? Any last question? I'm just also going to put my email address. If you have any questions on Glific, you can get in touch with me. This is my email address here. Okay, all right. So we'll close the session now. Thank you very much, Meeta and Varun, for showcasing the work that Arogya World has done on the mDiabetes program. I really had a great time listening to the entire presentation, and I hope everyone did that too. Okay, all right. Yeah, thank you so much. Okay. Okay, bye-bye everyone then. If you have any more questions, I'm going to stay here for another 2 minutes. You can, ask questions to me if you have any.